Many Nigerians believe that not eating on time causes stomach ulcer. You may have even heard someone say, "Make sure you eat quickly before ulcer starts." Or, "I can't have ulcer because I love food too much." But here is the shocking truth. Hunger does not cause stomach ulcer. In fact, this common belief has made many people ignore the real causes of ulcer, and by the time they finally seek medical help, the condition may already be severe. Some people even end up in the hospital with bleeding ulcers or ruptured stomach lining, which can become a life-threatening emergency. So in this video, we are going to talk about what stomach ulcer really is, the real causes, the warning signs you should never ignore, and what you can do to protect yourself. First, let us understand what a stomach ulcer actually is. A stomach ulcer, also known as a peptic ulcer, is a sore that develops in the lining of the stomach or the upper part of the small intestine. Normally, the stomach has a protective lining that protects it from the strong acid used to digest food. But when this protective lining becomes damaged, the acid begins to attack the stomach wall, leading to the formation of a painful sore called an ulcer. Now let us talk about the real causes of stomach ulcer. One of the main causes of stomach ulcer is a bacteria called Helicobacter pylori, often shortened to H. pylori. This bacteria can live in the stomach for many years and slowly damage the protective lining of the stomach. Over time, this damage can lead to ulcer formation. Another major cause of stomach ulcer is the frequent use of certain pain medications. Drugs such as ibuprofen, diclofenac, aspirin, and some other anti-inflammatory drugs can weaken the stomach's protective lining when used frequently or in high doses. Many people take these medications regularly without realizing the damage they can cause to the stomach. Smoking and excessive alcohol consumption can also increase the risk of developing stomach ulcers because they irritate the stomach lining. Now let us address the big myth that many Nigerians believe. Skipping meals or eating late does not cause stomach ulcer. However, if someone already has an ulcer, staying hungry for long periods can make the pain worse because stomach acid irritates the already damaged area. This is why many people mistakenly believe that hunger caused the ulcer. Now let us talk about the warning signs of stomach ulcer. One of the most common symptoms is burning pain in the upper part of the stomach. This pain may come and go and sometimes becomes worse when the stomach is empty. Some people may also experience bloating, frequent burping, nausea, or a feeling of fullness after eating small amounts of food. In more serious cases, ulcer can lead to vomiting, severe abdominal pain, or passing black stool. Black stool may indicate internal bleeding in the digestive system, which is a medical emergency. If ulcer continues to worsen, it can even cause a hole in the stomach lining, a condition known as perforation. This is a life-threatening emergency that requires urgent surgery. The good news is that stomach ulcers can be treated when diagnosed early. Doctors usually perform certain tests to confirm the presence of H. pylori infection, and treatment often includes medications that reduce stomach acid and antibiotics to eliminate the bacteria. Avoiding unnecessary use of certain pain medications can also help protect the stomach lining. If pain medication is required, it should always be used carefully and under medical supervision. Maintaining healthy habits, such as avoiding smoking, limiting alcohol, and eating balanced meals can also support stomach health. However, there are certain warning signs that should never be ignored. If you experience severe stomach pain, vomiting blood, black stool, sudden weight loss, or persistent vomiting, you should seek medical attention immediately. These symptoms may indicate a serious complication that requires urgent medical care. In summary, stomach ulcer is a serious digestive condition that many people misunderstand. It is not caused by skipping meals or eating late, but most commonly caused by H. pylori infection and frequent use of certain pain medications. Recognizing the symptoms early and seeking proper medical care can prevent dangerous complications. Your stomach plays a very important role in your overall health, and taking care of it should never be taken lightly. If you found this video helpful, make sure you like this video, share it with others, and subscribe for more health topics.